Hey everybody, Shawn Keating here. I want to welcome you to this week's episode of the Dental Up Podcast here at Keating Dental Arts in beautiful Irvine, California. This week we have a special guest on the show. He's a longtime partner of ours and he's been with us since we started our lab. He runs a thriving dental practice in Piston, Pennsylvania. Please welcome Dr. Shawn Casey DMD. What's up, baby?
Not too much. What's happened? Thanks for having me on your show.
Oh, dude, that is so cool. I always like, I think of you all the time because way back in the day, I remember, we've worked together for a long time, but I remember I'm such a football nut and, somehow you knew Rudy Ruettiger from the Notre Dame, and we did his case, and we did all his teeth, man, and I got to meet the guy. He came to our lab a few times and went to Vegas with us. But tell me a little bit about that, Dr. Casey. How the heck did you get to meet Rudy? I mean, I still freaking cry to that movie when I see it, and I see it probably once every 2-3 months when it's on cable somewhere, and I'll just watch it like when he sneaks into the coach's room, or just like his brother giving him crap in the stands and like who's never stay at the steel mill, and you know the whole thing. Ned Beatty is his father, wasn't it? And but what a great show, dude. How the heck did you end up meeting Rudy Ruettiger? Tell me a little bit about that.
Well, you're right about the movie. The movie's actually shown all over the world at any given time over in daytime. That movie's actually being shown somewhere. It's funny that you said that. You always see it every once in a while, but it is a classic movie. It's a great movie. It's an inspirational movie. Every kid, every adult loves it. Man and female, they all love the movie. I was in charge of, with a name like Shawn Casey. First of all, you could tell how you and I liked each other with the first name Shawn. You don't see too many of those being in society, but
exactly.
We met one time. We were trying to get a speaker to come to our banquet. It was the Friendly Sons of Greater Pittston. And every year we have speakers that come in. So I said, we're going to try to get Rudy.
Can you believe that? And, you know, he is such, I guess that's what he does, motivational speeches. And, you know, he's a speaker from, you know, and just, it's just a neat thing. And we actually got him after we did his teeth and everything, and we got him to come out to Vegas because he lives in Vegas, and we had a Dental Town show, and I remember I had it to where I was talking to Howard Friend, and I said, dude, man, let's get Rudy to do a little speech. So he did like the keynote, I think, or something. We had him do it there, and the thing was they all had to come by the booth afterwards, my booth, the Keating Dental Arts booth, to get a signed picture or whatever. But that was like the best, most volume we ever got at a dental show, where doctors, we could get their information or give them a free packet of our, you know, lab scripts and, you know, fee schedule, but they had to come through because I had Rudy at my thing, and there was hundreds of people in line after that speech. And, you know, I remember listening to him there and just so engaged with the guy, his story and what he came from, and, you know, the perseverance and everything that, God, it brought a tear to your eye just listening to him talk, and it just pumped you up. But what a great guy, what a great story. And so tell me a little bit about, what do you find passionate about in terms of dentistry? What do you like doing? What do you don't like doing? Tell me a little bit about that.
I like the idea of, so I'm practicing now for over 20 years, and I see different challenges amongst different students graduating from dental school today. They're in a lot of debt, whereas years ago, not too many people were in a lot of debt with their dental school loans and everything else. So my passion is try to create a work environment that we can have dentists, specialists, and everybody work together in one facility, work as a team. I'm very passionate about the team approach. So, you know, we have a facility here where we have specialists, orthodontists, along with pediatric dentists and ourselves, and we have a special needs dental clinic. We try to basically take care of all access to care needs that the area needs. And if we can create an environment with special technologies and, you know, all this other, you know, latest and greatest stuff that this next generation is used to using, we can provide a nice work environment for them. That's my passion, is trying to expand and grow and do it that way.
That's awesome, dude. Tell me in your practice, man, tell me like, how many ops you got working, associates? I know it's kind of neat. You're doing a whole pediatric thing and with the children and all that. And I think you're doing some special needs children. And, you know, I think
we're trying to, the goal is to have complete family dentistry in one facility with specialists. And it's been a struggle getting specialists because some specialists don't like to work with general dentists. They feel like no one's going to refer to them. But we created a concept that we can keep them busy. That's always the first question I have when I talk to different specialists. But our pediatric, we have 2 associates that are down there now, developing it, and it's growing and growing and growing every year, which is nice. From that, I learned some of the children need special attention due to their behavior. So, not everything is easy. Sometimes they need sedation, especially the younger ones. So we're in the process right now of building a surgery center so we can accommodate those needs. We also have a special needs clinic, and we've been doing that now for some time. And most of those folks sometimes, unfortunately, need some type of behavior management, so they would also benefit by going to a surgery center.
That's tough, dude. How do you do that, man?
It's a challenge. I mean, it really is a need. I never thought, it's complicated because some of these folks, unfortunately, don't know. They can't reason with the doctor. They can't reason with themselves because of their handicap or their disability. But I think we do a real good job of making them comfortable, and I think we do a real good job of taking care of their needs. And the doctors I have are great with them. So,
gosh, that is.
That being said, we just want to take it to the next level. We just want to keep expanding on it. We see there's a need for it in our area, the surrounding area. I mean, our special needs dental clinic attracts patients up to 2 hours away.
Really?
And they find it easier to come to us, because this is where we're located, because it's easy. It's a nice, easy drive. You're not going through a main traffic. You're not going through downtown Los Angeles to get to a visit for somebody who has a hard time sitting in the chair long enough.
Yeah.
Bad enough driving somewhere. But that's one of our challenges here. But we enjoy every moment of it. I had an aunt who had Down syndrome, so that's what gave me a little bit of a backbone to start. I say, we need to do something. So I just expanded off of that. Being raised with her, I always say, you're raised with one of God's children. Try to benefit from it, and that's what I got out of it. So that's our give back, and I think it's been real successful. And I think we have a great crew here, and they do a great job.
That's so.
And then our other aspect is that we have orthodontics. We have braces. So we have 2 orthodontists that are in the practice, and that keeps the teeth moving for us, as we like to say. They're always shifting them back in place.
What kind of ortho are you doing there? Anything particular?
They're doing Invisalign, and they're doing, I believe, some of the Damon technique with the brackets and traditional, regular traditional braces, along with Invisalign and the Damon brackets.
Yeah, that's cool. What about any power procs or 6-month smile type stuff, or is that too expensive? It can get pretty pricey in just getting the materials from those companies, huh?
No, I mean, I don't. I let those doctors make their own decision on what they want to do. They entertain some other companies. I'm not familiar with them.
Okay.
Whenever I get something across my desk, I always forward it to them. And some people are just so content of doing what they're doing, they don't want change. Yeah. But anything that's going to make it easier for the patient and make it accessible, we'll listen, because it's going to make our life easier.
Oh, absolutely.
And make it better that way. In the general department, we have multiple doctors. We have 4 GPs that work here, and we have a real good program here in the office. And we try to cater to the folks that work a little bit later at night, so we stay open a little bit in the evenings. And then we communicate back and forth. The general department, especially you have a patient that's in pediatrics that becomes a teenager, and maybe he needs braces, or then later he wants to shift over to the general clinic. We have all his information. We know who he is. The doctors know who he is. And if we need something, or we need to resort back to something, we can communicate one of our specialists here, which works out great for us. I just think it's an overall paints a better picture. Easier way of doing dentistry in this new generation.
Absolutely. Get the right people doing the right procedures instead of, just do what you do best, and you surround yourself with a lot of great people, because you're crushing it. You've been crushing it for years, dude, and we thank you for all the work. That's just really awesome. But you really are.
Yeah, we've been with you guys since day one.
Yeah, thank you, man. We appreciate that. It's just so cool. But you run a good, strong practice. Your staff is top notch. I mean, you even brought staff with you down here before, and they're just great people. When you have people that kind of love what they do, and you take care of people, it comes back to you. And just another one of our dentists. I've had a few guys on lately that, they just start talking about staff and taking care of people, and like you even giving back to the community in different areas with the children and stuff like that. A lot of doctors don't want to touch that with a 10-foot pole, and
It's a challenge. Believe me, you have
Oh,
to make your contagiousness of trying to tell somebody how you're passionate about something. Sometimes people don't agree with you, and
oh yeah.
sometimes staff doesn't agree with you. They have their own agenda,
Yep.
and that's true. I mean, that's true in any business, to be honest with you. And to me, that was the hard part of developing this business. The dentistry and the construction and the infrastructure, that's the easy part.
Yep.
To me, that's like I could do that with my eyes closed. That's
Yep.
how easy it is designing a building or making an operatory or building a 20,000 square foot facilities. That comes easy to me. But the staff, whole different ballgame.
Yeah.
Throw away the books, throw away everything you learned. Because
Uh,
there's not been a day that goes by or a month that goes by or a year that goes by that something else pops up or challenges us.
Yeah.
I mean,
Dude,
I mean,
it's
just
every day, and it's never going to go away. I mean, it happens to me here, and it's just tough, you know. You
and if a
work.
dentist knows how to communicate properly in the next generation, my advice to a new dentist is, you can type and you can talk all you want on that telephone in your hand. But at the end of the day, if you know how to communicate to somebody and you know how to express concern and you know how to interact with them, that's the secret to your success in your practice.
Yeah.
That right there is going to be half the battle because this generation, when I call my kids, I want to reach out there. I want to say, pick up the goddamn phone. I said,
Yep.
they don't want to, everything is a text message. Pick me up here. Do this, do that.
Yeah.
That's all they're trained on. That's all they want to do is text.
Exactly.
They don't want to communicate. Talk
Get on
for
the
a while.
phone, or let's come face to face.